Have you ever heard someone say their cataract came back after surgery? It sounds scary, doesn't it? You go through the procedure, think it's gone well, and then months or years later, your vision turns cloudy again. I know it feels alarming. Many people I see worry about this very thing. So, I'm going to go through what's really happening today. My name is Dr. John Legarreta, and I'm a board-certified ophthalmologist and cataract surgeon. In today's video, I'm going to explain why cataracts can't return once they're removed, what actually causes this second round of blurry vision, and most importantly, how we can fix it. So, can cataracts really sneak back after surgery? Well, to clear this up, we need to look at why cataracts simply cannot come back once they've been treated. A cataract forms when your eye's natural lens, the part of the eye that focuses light, starts to cloud over as proteins break down. In cataract surgery, that cloudy natural lens is removed completely and replaced with a clear artificial intraocular lens, or IOL. This implant is made from synthetic material, not living tissue, which means it doesn't contain the proteins that can clump and turn cloudy. So in other words, there's no way for a true cataract to reform on your implant lens. Some people still worry when their eyesight gets hazier months or even years after surgery, and they wonder if the cataract has started to come back. But here's the key point. Because we've taken out the original lens, there's no surface left inside your eye for cataract to grow on again. So cataracts only exist really in the natural lens setting, and that part has already been replaced. That's why every major medical body agrees. Once removed, cataracts don't come back. And it may help to picture this like a cracked window in your home. The crack makes it hard to see out. So you call someone to replace the entire piece of glass. Once the new pane is in place, the old crack is gone for good. It can't grow back on the new glass. The window might still get dirty or foggy at some point, but that's a different problem altogether. And this same idea applies to your eye after surgery. The cloudy natural lens is gone, and the new implant cannot develop the same issue. Now, it's worth being completely open here. The artificial lenses used in cataract surgery are designed to last for life, and the vast majority do exactly that. Very rarely an implant may shift or develop another complication that requires follow-up care. But even in these unusual situations, that's not a cataract returning. It's simply a different type of issue unrelated to the original condition. What's much more common, typically long after surgery, is that people notice their vision blurring again and assume that must be a cataract. But remember, the cloudy lens is no longer inside your eye, so the cataract itself can't grow back. If you're experiencing new haziness or glare, this may have another cause entirely. And this is where so much of the confusion starts. There is a separate condition that can look and feel nearly identical to a cataract, even though it isn't one. And it's the reason many patients come back worried, thinking their cataract has returned when it hasn't. So, what exactly is causing that cloudy, fogged up vision after surgery if it's not a cataract? Well, simple. That answer is what we're going to uncover next. But before I answer that, I need to discuss the cloudy change that so many people notice after surgery is actually caused by something that's completely different than a cataract. And the medical name for this, posterior capsule opacification, or PCO for short. And sometimes, confusingly, people call this a secondary cataract. Nickname can give really the wrong impression. PCO isn't a cataract at all. Your cataract was removed permanently during surgery, but the capsule, which is a thin transparent membrane that holds the new artificial lens in place, is left behind. It's this capsule that can lose clarity over time. And here's how it happens. During surgery, the cloudy natural lens is taken out, but some lens epithelial cells can remain on the capsule. In most people, these cells stay quiet, but in others, they start to spread, thicken, or wrinkle along the capsule. That microscopic growth can scatter light passing through, almost like a film spreading across glass. To your eyes, the effect is a return of a hazy, blurry vision that feels just like you had when the cataracts were in your eye before they were fixed and you were trying to get them fixed in the first place. So think of it like changing out a broken window pane. The repair means that the old crack will never reappear because the glass is gone for good. But if condensation later forms across your new window, the view looks blurred again. The glass itself is still solid and intact. It's the thin moisture layer that's clouding your view. And PCO works the same way. Your intraocular lens remains clear, but the capsule supporting it can slowly turn cloudy and then distort your vision. And the situation is not rare. PCO is common. Studies show between 20 to 50% of adults develop some degree of capsule opacification within 2 to 5 years of their cataract surgery. And in children, the rates can be even higher. Certain factors increase the chance of it happening, such as younger age, eye inflammation like uveitis, glaucoma, retinal disease, diabetes-related changes, something called pseudoexfoliation related to glaucoma, or even previous vitrectomy surgery. Knowing this helps patients understand they're not alone, and there are clear reasons why some people are more likely to develop PCO than others. And the visual changes that it causes are easy to relate to. You might notice more glare or halos from headlights at night, a gradual blurring that makes reading less comfortable, or the colors looking less vivid than they did before. These symptoms typically creep up slowly, and because they feel so much like the original cataract, it's natural to think it somehow has come back. But it hasn't. What you're experiencing is a posterior capsular opacification, which is a completely separate condition that only looks and feels similar. The treatment for posterior capsular opacification is straightforward. It's called an ND YAG laser capsulotomy, more often referred to as YAG laser capsulotomy. This quick procedure safely clears the cloudy lens capsule without needing another surgery. Here's the basic idea. When the capsule clouds over, the laser creates a tiny opening in its center. The new opening acts like a window, allowing light to pass through the intraocular lens again so vision becomes clear. Nothing physically touches the eye inside. There are no stitches or incisions, and the whole process usually takes less than 5 minutes. From the patient's perspective, the process feels simple and structured. First, you come in for a regular office visit. No hospital or operating room needed. Second, numbing and dilating drops are placed in your eye so the doctor can see the capsule clearly. Third, while you sit in a machine similar to the one used for eye exams, the laser creates the small, precise opening in the capsule. And fourth, vision often sharpens quickly, sometimes even before leaving the office. Most people wonder whether the laser causes any pain. The answer is no. It generally is painless. You might notice a quick flash of light or hear a clicking sound, but beyond that, there's little to feel. Occasionally, short-term floaters drift across your sight after treatment, but those usually settle within a few days. In fact, many patients walk out noticing crisper details or brighter colors, with full results developing over the next 24 hours. And the recovery is just as reassuring. After the procedure, you can return to most of your normal activities right away, though your doctor may suggest avoiding certain strenuous activities briefly. There's no need for general anesthesia and no lengthy healing period. Most patients describe it as one of the simplest medical treatments they've ever had. Of course, though, with any eye procedure, it's important to mention safety, and the YAG laser capsulotomy has an excellent track record, but very rarely complications can occur, and these may include short-term rise in eye pressure, mild inflammation, swelling in the back of the eye, or in extremely rare cases, retinal detachments or retinal tears. Because these risks are uncommon but possible, your surgeon will review them with you and schedule follow-up checks to ensure the eye is healing well. Ever notice increasing floaters, flashing lights, or curtain-like shadow after the procedure, you need to call your eye doctor right away. Acting quickly is the safest approach to protecting your sight long-term. So what matters most is that this laser treatment effectively clears the cloudy capsule and restores vision. It reassures patients that they don't have to go through cataract surgery all over again, can return to clear, dependable eyesight with minimal interruption. And this brings us back to the larger perspective, understanding why cataracts once removed never actually return. So here's the takeaway. If you notice hazy or blurry vision months or years after cataract surgery, it's not the cataract coming back. What you're most likely experiencing is posterior capsular opacification, and the good news is that it's easy to treat with a quick YAG laser procedure in the office. However, you do need to see your eye doctor for a regular checkup and for a follow-up for these symptoms, because there are other reasons why you could have blurry vision after cataract surgery. But by and large, when it's a PCO, it can be treated very easily with the laser in the office. And remember, cataracts don't come back. So if your vision does become cloudy again, you need to call your eye doctor. It's usually an easy fix if it's a PCO. I'm Dr. John Legarreta. Subscribe for more eye health answers so you can see the world with confidence. Thank you.